Hello, this is a video about spinal cord injuries, their symptoms and their treatment. Specifically, we are focusing on the question, why didn't Christopher Reeve recover from his accident? First of all, who is Christopher Reeve? Christopher Reeve was an American actor who became famous in the role of Superman in 3 movies. He was born in 1952 in New York and died 2004 at the age of 52. Apart from being an actor, he was a disability activist, among other things lobbying for increased federal funding of stem cell research. He held several leading positions in organizations concerning quality of life improvement. Among others, he was chairman of the Christoph and Dana Reeve Foundation, which among other things raises funds for the field of stem cell research. You might have noticed a quite drastic career change there. After May 1995, Reeve could no longer act as he used to. He took part in a horse riding competition and had an accident. He landed on his head and shattered his top 2 vertebrae, C1 and C2, and severely damaged his spinal cord. Moreover, the impact left him with a central fluid-filled cyst surrounded by a narrow donut-shaped rim of white matter. This donut-shaped rim of tissue was the result of cells in the center of the spinal cord dying off because of the injury. This loss of cells prevents the spinal cord from functioning properly and interrupts the transmission of messages between the brain and the rest of the body. After the impact, he was no longer breathing, but received artificial respiration immediately. The cyst you can see on the right. The perimeter of the cord is circled in black, here, and the internal cyst is white in panels C and E. Now we are going to look at the symptoms that usually come with upper spinal cord injury and have a closer look at how Reeve was affected. Spinal cord injuries in the top 2 vertebrae, C1 and C2, often result in death. Those who do survive will be paralyzed from the place of the injury and everything below it. Consequently, the symptoms following an upper spinal cord injury are rather dramatic. Injuries to the vertebrae C1 and C2 may include complete paralysis of arms and legs, muscle atrophy, limited head and neck movement, compromised continence control, trouble breathing without an apparatus and assistance, loss of sensation and reflex function below the point of injury, sexual dysfunction, and a lot more. The list of symptoms is extensive. Here on the right, you can see that a disruption of the spinal cord at C1 or C2 impacts life-essential functions like breathing, the heart rate, and movement control. Patients with spinal cord injuries, short SCIs, are often classified according to the SIA scale, which serves as an international standard for classifying SCIs. Grade A is the most severe class, with no sensory or motor function preserved in sacral region 4 to 5, and slim to no outlook of improvement. Class E is a patient with normal motor and sensory function. 1 month after his injury, Reeve was classified with a grade A on the SIA scale. He had complete motor and sensory function at level C2, partial preservation of sensory function at C3, and spotty sensation in the left hemibody. This level includes absence of sacral function, such as voluntary anal contraction. But is that it? Is there no hope for patients with upper SCI? Let's look at treatments and Reeve's recovery. First of all, an injury to the spinal cord in general is highly problematic. Surgical interventions after such an injury are highly complex and threaten to harm the patient even more. Gathering research data of patients with spinal cord injury is also complex due to the high heterogeneity of injuries and because of limited accessibility to the injury. Moreover, in the CNS, there is no generation of neurons, in contrast to the peripheral nervous system, where axons can grow up to 1 millimeter per day after an injury. Interestingly, there are also so-called no-go proteins that actually inhibit regrowth of neuronal cells in the central nervous system. It's important to note that treatment options for vertebrae injury at the C1 and C2 levels will not reverse the damage. Survivors of cervical spinal cord injuries at this level will likely require assistance for the remainder of their lives. That being said, current treatments for C1 and C2 SCIs include surgery to relieve pressure from the spinal cord and fuse the affected segments together to prevent movement, because movement could lead to further damage to the spinal cord. Such a surgery was done in the case of Reeve, which you can see here. Another form of treatment could be prescription drugs to aid the recovery of sensory and motor function, as well as to reduce inflammation in the affected area. Physical therapy to strengthen unaffected areas of the body so the patient can learn to use the remaining body function, as well as activity-based therapy for the affected areas. The idea is to strengthen affected muscle groups to prevent atrophy. Finally, there's also the use of stem cells as an SCI treatment. It has shown promising results in regeneration function lost due to AACI. We will have a closer look at the last two treatment methods in the next slides. Now let's have a look at the treatment that Reeve got and how he recovered. Reeve was subject to a n=1 case study called Late Recovery Following Spinal Cord Injury by McDonald et al. From 2002. The researchers used activity-based recovery treatment over the course of 3 years, starting in 1999 and ending in 2002. At the end of 1999, Reeve was still classified as grade A on the SIS scale we saw earlier. The treatment consisted of Reeve training on a modified bicycle while surface electrodes stimulate the muscle groups relevant for the movement. A sketch of such a bicycle you can see here. Later they included aquatherapy, which focused on the muscle groups that were still too weak to overcome gravity. This treatment led to an increased muscle tonus and generally improved health by 2000. The first milestone was at the end of 2000 when Reeve was reclassified to grade B on the SIS scale. This meant that he had sensory but no motor function preserved below the neurological level and extending to the sacral region 4 to 5. The next milestone was in July 2001 when he jumped to grade C, which was an unheard of improvement for someone originally classified as grade A. This meant that he had motor function preserved below the neurological level and that the majority of key muscle groups are strong enough to move a body part through its full range of motion against the force of gravity. But when resistance is applied, the muscle is unable to maintain the contraction. To answer the question of this video, Reeve did not fully recover from his injury due to a number of reasons, chief among them being the inability of the CNS to regenerate after an injury and the fact that there are inhibitory proteins that limit axonal regrowth. However, the case study of Reeve also shows that there is room for partial improvement and highlights the importance of undergoing some sort of activity-based treatment after the injury. Now let's have a look what the future of SCI treatment has in store for us. To make it a full circle, we will now look at stem cell therapy, which, as mentioned before, is supported by the Christopher and Dana Reeve Foundation. There are two properties of stem cells that make them a very promising treatment for spinal cord injury. First, they can differentiate into a wide variety of cell types depending on their environment. Second, they can divide infinitely. The idea is to inject them into the spinal cord so they can replace damaged neurons and restore neural circuitries. These qualities make stem cell therapies hold great promise to become an effective therapeutic approach for SCI. Although there is abundant evidence that stem cell research can prove helpful in SCI, there are still some major concerns, especially for human SCI treatment. For example, there is the issue of stem cell tumorigenicity, so that the stem cells function to divide limitlessly becomes a burden and they turn into a tumor. Or the transplanted stem cells often maintain in the state of undifferentiation. Also, there are different types of stem cells. Which type of stem cell is the most suitable for cell replacement therapy in patients with SCI still needs to be clarified. Also, there are ethical concerns about the extraction of stem cells. Moreover, standard protocols are difficult to confirm due to the heterogeneity of the injury type and level, and there are numerous other concerns. Nevertheless, there are promising advances in the field of stem cell therapy. In a recent study by Guo et al., the researchers used stem cells to treat rats with severed spinal cords. They demonstrate that when the stem cells were given intranasally, they could pass the blood-brain barrier and mitigate to the injured spinal cord area. A sketch of the procedure you can see here. The results of the study showed that stem cell therapy can help rats with severed spinal cord regain considerable movement functionality. Functional recovery was accompanied by biological changes of reduced neuroinflammation and gliosis, which is a detrimental reactive change of glial cells in the CNS, as well as increased axonal regeneration and angiogenesis, which is the process of new blood cell formation. Moreover, there were structural and electrophysiological improvements. Although the obvious hitch that this is a study with rats and not with humans it can still be seen as exemplary for the degree of innovation and progress in the field of stem cell therapy. This study even circumvented the major concern of surgery in or near the spinal cord. This makes leave us hopeful for a better quality of life after a spinal cord injury. These are my sources, and thank you for your attention.